First of all, good afternoon, our respective structures and professors. My name is Linh, a fifth-year medical student of the University of Medicine and Pharmacy. And today, on behalf of our research group, I'm honored to present our topic, association between ApoB to ApoA1 ratio and severity indicators in patients with acute coronary syndrome. And like other presentation, we also have 5 main sessions: introduction, objective, subject and methods, result and discussion, and conclusion. As we all know, coronary artery disease is one of the leading causes of mortality in the world. According to World Health Organization in 2021, ischemic heart disease is the second most common of death in lower middle income countries, including Vietnam. And among its clinically manifestation, acute coronary syndrome is the most severe and life-threatening form, carrying a high risk of mortality if not recognized and managed promptly. So acute coronary syndrome includes ST segment elevation myocardial infarction known as STEMI, non-STEMI, and unstable angina, which classified based angiographic finding, ECG changes, and biomarker changes. As we know, far more important than diagnosing a disease when it occurred is the prevention, the risk factor in order to stop disease progression. And one of the most important risk factor is lipidemia. For many years, we use traditional lipid markers such as LDL cholesterol, non-HDL cholesterol, or triglyceride to assess the dyslipidemia. However, this biomarker just reflects the cholesterol concentration, do not capture the number of atherogenic lipoprotein in particular, which is the key factor for atherosclerotic burden. So we have ApoB. ApoB is a structural component of lipoprotein atherogenic, such as VLDL, LDL, IDL, or lipoprotein A. And in contrast, we have ApoA1 is the major component of HDL, which creates a protective effect. So the ApoB to ApoA1 ratio is the balance between atherogenic and protective lipoprotein, and providing a more comprehensive assessment for cardiovascular risk. And a higher ApoB to ApoA1 ratio reflects a higher cardiovascular risk in this patient. And in fact, we have several international studies have demonstrated the high prognostic value of ApoB to ApoA1 ratio in cardiovascular disease, especially in acute coronary syndrome. For example, we have a study conducted in Indonesia in 2015 have shown that the high ApoB to ApoA1 ratio is strongly associated with the increased risk of in-hospital major adverse cardiovascular events in this patient. And similarly, we have 2 studies conducted in 2021 by Janssen and Hore have shown that there was a significant positive correlation between ApoB to ApoA1 ratio and Janssen score. It is a reliable scale for assess the severity of coronary artery injury in patient. So we have many evidence from international study, but the evidence in Vietnam is limited. So that leads to an important question. In Vietnamese population, this ratio reflect disease severity as the same way as international study do. And that this gap in local data is the reason why we conducted our study with 2 objectives to determine the ApoB to ApoA1 ratio in hospitalized acute coronary syndrome patient. And the second is evaluate the association between ApoB to ApoA1 ratio and severity indicators. Our study had 103 subjects divided into 3 groups: unstable angina, non-STEMI, and non-STEMI. This is a cross-sectional study conducted in Huế Central Hospital with the patient diagnosed with ACS, including STEMI, non-STEMI, unstable angina, and who underwent percutaneous coronary angiography with the exclusion criteria as you see on the slide. The results show that there was a significant differences in the prevalence of smoking and diabetes among 3 groups, and the mean age of our study is 69.3 years old, and the male to female ratio is approximately 1:1. These results show that we have a significant differences between of high sensitive troponin T, and EF among 3 groups. And these results show that the STEMI group had a highest ApoB to ApoA1 ratio and highest ApoB among 3 groups and lowest ApoA1 among 3 groups. When evaluation by ApoB to ApoA1 ratio by severity indicators in ACS, we show that ApoB to ApoA1 ratio is higher in patients with severity indicator, except for arrhythmia. And a multivariable regression analysis were performed, and these results show that ApoB to ApoA1 ratio is independently associated with the severity of coronary artery lesions, include chances above or equal 40 and above or equal to in lesion coronary arteries and regional wall motion abnormalities. So this is our limitation in this study. The sample size is limited, and this goes a single center, and it can affect the generalizability when applied to a proper population. And this was a cross-sectional study, so we can assess the causal relationship between variable. Just can assess the association. And here is our conclusion. The ApoB to ApoA1 ratio was higher in patients with severity indicators and was independently associated with high Janssen score, multivessel coronary disease, and regional wall motion abnormalities. And we need further research is needed to assess the clinical utility of the ApoB to ApoA1 ratio in association with the severity of acute coronary syndrome. And that's all of my presentation, and thanks for listening.